Hey everybody, great to be joining you here today on the Cabral Concept. This is episode 3478. If you want to check out the show notes, what I want to share with you is a little known alternative to surgically removing potential skin cancer based sites. So when, if you're at a local beach, a public beach, you'll often see people on their back, on their arms, on their neck, sometimes even their face with these raised, almost like lumps of scar tissue. And typically what it is, if you're not familiar, is that they've had some type of precancerous skin lesion removed. Now, maybe it's a melanoma, maybe it's a mole, etc., but they have it removed. And the reason why it's a bit raised is that typically they need to go a little bit deeper under the skin. And then when it's sutured together, you're getting the scar tissue and you're getting the thickening of that skin. And then if you don't use sunscreen on that, you can actually get some darkening from that, especially from the sun. And so, that's the conventional practice right now. And I'm not saying that it's wrong. So I'm not saying that if you have precancerous moles or precancerous skin lesions or melanoma, whatever it might be, yes, you may want to remove them early. Again, I don't want to provide you with any medical advice, medical plans, medical cures, medical diagnosis. Nobody can do that on a podcast. I'm not trying to do that. What I want to share with you though is that there is an alternative now. And it's worth looking into, especially for older adults that don't necessarily want to have 3, 5, or maybe even more, because some people have to have a lot of lesions removed. And it's called Electron Beam Therapy. So it sometimes goes by different names. I'm going to give that to you in case you see them in articles, or you see it online, because you'll see more of this. But it's called image-guided superficial radiation therapy, kind of a longer one, or electronic brachytherapy. So what it does is it avoids all of the minor surgery, right? The cutting, the stitches, the scarring, and the downtime. And it does this by pointing and essentially an electron beam, right? So a small amount of low energy electrons get beamed just at the surface of your skin. Now, when you hear radiation, automatically you should be suspicious. I'm suspicious as well. Trust me. And like I talked about on the DEXA scan on a previous Friday review, when you use some of these therapies, they are very low level radiation. Now, again, still proceed with caution. I totally agree with you. But when we talked about the microsieverts, that's how you measure radiation. The electron beam therapy is typically between the 5 to 10 microsieverts. Now, if we think about an X-ray, chest X-ray, that's 100 microsieverts. If we think about sun on an average day when we're outside and then just background radiation of living on the earth, it's about 10 microsieverts. So it's not nothing, but it's about a day's worth of kind of solar background radiation that we would get in the world. All right. So I just kind of want you to know, like to be unbiased, there is some radiation. It's low level. It does not penetrate deep into the skin. It actually just works on the surface of the skin and maybe a couple millimeters below, because after all, you need to get whatever the lesion is below the skin as well. So what is it typically being targeted for? Well, it's the superficial use. So again, anything that you can see on the skin, not below the skin, but on the skin. Basal cell carcinomas are one, squamous cell carcinoma, and some early stage melanomas. Okay, so that's typically what it's used for. Certainly you would talk to your dermatologist or someone qualified to do this to see if they're using this in their office right now. The big benefits though are the no cutting, right? Like literally there's no surgery and there's no scalpels. So if you're, nervous about that, but also there's no stitches and there's going to be no real scarring. Now, there can be some discoloration of the skin. Usually from what I've seen, it goes away within a number of weeks maximum, especially if you're protecting that skin. And it's also painless. So that's kind of nice, right? So you're basically getting it's targeted therapy. Like it's literally electrons being beamed at this thing, destroying, blowing up those cells. And that is how it's being removed from the body. So that is exactly how it's being used right now. And it's being used mainly in older adults that don't necessarily want. They go into the dermatologist says, okay, we've got 3 to 5 specific areas that I don't like the looks of, and so we want to remove those. Okay, we can remove them typically, again, by surgically removing it, or now this EBT, the electron beam therapy. And with relatively low radiation, it might be worth considering. Again, I'm not telling you to go with this over the typical conventional surgical removal, but they each have their own upsides and downsides. The healing time with the EBT is there's no downtime. It's kind of nice, right? The stitches is 1 to 2 weeks, right? You're being careful because you have stitches in your back, your arm, your neck, your face, whatever it might be. With the EBT, there's almost no scarring. Typically, unless you're going to a plastic surgeon, there's almost always some scarring, even with, I guess, a plastic surgeon that's doing these. I don't know the specific name for someone that does that, but usually, someone does the finer details with the sutures and all that so that there is not any scars. But almost always there is, because you had part of your skin removed, right? You didn't have just a tiny bit. You typically had maybe a 1/4 inch to a 1/2 inch removed, and now they need to pull that skin together. Almost always that's going to lead to some type of scarring. The EBT is non-invasive, whereas obviously surgical excision is invasive. So what I would say is this, is that especially in harder to excise places like the fold of a neck or on an elbow, that this type of therapy might be even more suitable for those more sensitive areas. Now, what I will say though is it's almost always with early stage basal cell or squamous cell, and certainly with melanoma. So not everybody's going to necessarily qualify for it. And especially those that are looking for more of a cosmetic-based procedure. Now, you still want the science, the efficacy of removing these precancerous based cells, but you don't necessarily want the scarring that goes along with it. And of course, for those people that just can't have 2 weeks downtime because of their job, their work, whatever, this might be, again, worth looking into as well. So those are all of my major what I got from researching this. It's still new. It's still, nascent. I mean, they've been using it for years now, but in terms of you seeing it at your local dermatologist, not everyone will have it. The nice thing is, how do you find this type of specific therapy? You can literally just type in EBT or electronic beam therapy, type in your city location, and then you're going to look specifically for a board certified dermatologist or a radiation oncologist with experience in this. So it doesn't always have to be a dermatologist. It could be an oncologist, yes, which is a cancer doctor. But remember, you're having precancerous moles removed. And so a radiologist that specializes in this, that does it every day, might be an even better thought process. So speak with your qualified doctor, your dermatologist, see if this might be the best option for you, if you're even a good candidate, and then decide if it is, again, like I said, the best treatment over the typical conventional removal of that precancerous-based skin lesion. Hopefully this was helpful. As always, if you know anybody that might need this information, send them on over to stevencabral.com/3478. That's where all of today's show notes will live. Take care, and I'll be back tomorrow with a brand new Cabral Concept. Thanks so much for tuning into today's show. Before you go, don't forget to hit that subscribe button. I want to make sure that you're getting our daily content, not missing out on anything functional medicine, wellness, weight gain, weight loss, anti-aging, living longer, stronger, and all of the most cutting-edge research. And if there's any topics you want to hear, feel free to leave them in the comments below. Take care.